where you saw this, but definitely in Michigan, it was constantly on the news. And so I grew up thinking this guy was willing to take a hit for everybody. And yeah, definitely one of my role models getting in, becoming a doctor in the future. So.
Well, let's keep it on the positive side of Dr. Kevorkian,
Yeah, but he was an advocate for patients.
Yes, no, he was.
And so that really, and he was willing to do anything for those people, and that really motivated me.
And he saw, I think, what patients were going through, and he had empathy for that.
Absolutely. So.
All right. Well, thank you. All right. Let's see here. I'm going to skip myself for a minute. I'll come back to me. Andrea. You write your story about PTSD. I think you're an advocate. I see you nowadays because you've been open about it. I see you as an advocate. I see you as a voice for PTSD patients and all that they have overcome to get where they are and to get where you are. So, according to your story, it's been quite a few years now. And I think what's interesting to me is you were talking about the HIA program. And I think when you started out on this, probably the PTSD diagnosis, there was no such thing. But now there is. So, what do you think of the HIA program, and is it working for you? Now, I'll say to the audience, I mean the Ohio Medical Marijuana Program. That's what I'm talking about, okay? So, what do you think?
I was diagnosed with PTSD at the age of 19, and I did not want to take pharmaceuticals to treat my symptoms. So my therapist suggested that I try medical marijuana, and I've been a patient in Ohio since 2019. I first started out with vapes and edibles. It was really difficult for me to find what worked best for me because it felt like there weren't a lot of resources for patients at the time. But I feel like the availability of such resources has gotten much broader over the past few years, and I feel like a lot of the industry workers are more educated and helpful about it now. You'll still get some bud tenders who don't have it in their heart to help a patient with medical problems. They just see him as a number or a consumer, but it takes a while to find a dispensary that works best for you and is actually willing to work with you to figure out how to treat your symptoms. I haven't been going to dispensaries as often as I used to, and that's because I have worked in the hemp and CBD side of the industry for the past 2 years, and I've seen that you can also get hemp-derived THC products and even CBD products to help treat my symptoms, especially the insomnia and the anxiety. So those symptoms have decreased over time. But another thing that really helped me was I tried multiple mental health therapists and different types of therapy. So my journey has not just been about medical marijuana. I highly recommend using it in conjunction with traditional therapy because it has helped me learn the coping skills. Unfortunately, there are still states that have no legalization, and if I travel there, I don't want to risk taking marijuana on a plane or in a car. So I have had to learn how to cope with those symptoms without the use of marijuana.
Let me ask you this. You mentioned Delta 9. Is it Delta 9 or Delta 8 that you were trying?
Hemp-derived Delta 9.
Delta 9. Do you notice any difference between that hemp-derived Delta 9 and the THC that you were consuming from other products in the dispensary, the dispensary products?
I will say the effects are pretty similar. However, with the hemp-derived Delta-9, it has to come in a form that is less than 0.3% THC by weight. So that really limits you to edibles and gummies and some vapes. So if you really like flower, that's not going to be a readily available option for you. And if you like consuming flower, I recommend going to a dispensary. But I've learned from working in the hemp side of the industry that it's a more accessible way for people to get relief. But if you're looking for higher THC content, obviously go to a dispensary.
Good, thank you. I've been wondering about that, thanks. Okay, thank you. I'm gonna move on here. I'm just gonna go to your, on my left, and it's Broderick Randall. Good afternoon, Broderick. Okay, from your stories, really, both you and your sister, it's pretty clear have a sickle cell anemia. That must be a very difficult path for you to walk. I know you've been in the hospital quite a number of times, and that's certainly, I can't even fathom that. I mean, I really can't. I mean, I honor you for your tenacity. I mean, able to put up with life. All right. So, over the past several years, with your you're actually with sickle cell. So she's PTSD. You're sickle cell. Do you purchase cannabis from the program?
Yes, I do. And I mean, before the program existed, I discovered that cannabis was a safer, better option for me than using opioids.
I think it's us.
Oh, all right. I was like, whoa.
I don't know, maybe it's me. All right. Keep going, sorry.
No, you're all good. I discovered that, after being hospitalized a lot and going to just doctor visits, the only main treatment for a while, I mean, they are getting newer treatments now, but for a while it was just pain meds, high dose pain meds. So, the side effects are, slowly destroying your organs and just, other terrible side effects. And it was just an awful quality of life. So then, I discovered cannabis and just continued to discover more about it. When most people hear it, they think of smoking, but there's so many forms of the plant that you can use that it's made me continue to be curious about it and just engaging to learn more and figuring out what works and what doesn't. Even as she says, you gotta use it in moderation, but you do have to we all have an endocannabinoid system, so it's cool to figure out I need this much gummies, or I may need this much topical, whatever. With sickle cell, it's a very complicated chronic disease, but so is the cannabis plant, and I've been learning that too. So it's kind of in a lot of ways they've been going hand in hand. The plant gets mistreated. Sometimes when they go in the hospital, you can get mistreated. Unfortunately, there's been mistreatment from even the color of my skin, and I just learned that you got to do your best to continue to be an informed consumer, and it's a good comparison I always try to say is directly in the medicine field, flower and vape carts are very instant relief, and then if you use compare that to in the medical field, there's the IV meds, they're quick to give you morphine or Dilaudid, and that's kind of what they give you for severe pain relief. But if I didn't want to use that, I can use some some higher powered cannabis and actually get a better relief effect, or there's some topical lotion or something and actually treat it that way. But it's all about being informed and being able to have access to it as well. Affordability is another big thing that we continue to run into with cannabis. It's not cheap, but it does grow out with or without us. But we're still working on getting that properly regulated. And I personally believe all use is medical use. We're just continuing to figure out with more research how but it's definitely provided a way better quality of life using this plant rather than just relying on the pharmaceuticals that are, I mean, they help, don't get me wrong, but if you can, some people can get addicted. We have a really big opioid addiction problem that is taking over in a lot of areas in the nation.
Have you found any? Okay, you have the sickle cell. Do you use cannabis multifacetedly? In other words, you use all different kinds of forms, or have you found one form that works best for you?
I don't discriminate. I use all forms, but I different forms are better for different situations.
Okay.
So it all depends on that too. Like they have capsules, they got topicals. I mean, there's different opportunities out there that you can try to adapt to the situation.
Good. Okay, I'm going to go to my right now. So that happens to be Dorothy.
Hi.
Dorothy, let's see. We were talking about this yesterday. That term caregiver, and it's. I can't talk about multifaceted. It's kind of like a multifaceted term. So caregivers and caregivers. Now, there's the caregivers that take care of the elderly and take care of your parents, your elderly parents, and things like that. And of course, the term caregiver has also been used to denote somebody who purchases cannabis for either an indigent person or a person who's really sick. Now, I was a caregiver under the latter. For about a year, and unfortunately last year my patient died. So, and I think I like to think that in a way, when I was serving her, I was caring for her. I cared very deeply about whether she got her cannabis, and I think that when she did get her cannabis, that's when things went haywire. Right? So that's my story. Anyway, I want to talk about caregivers. You said that you did caregiving for both your father and your mother.
Right, and usually it's a lot of people prefer to be called caretakers and there's the big difference between the system now saying you can be a caregiver for someone.
Exactly. Yeah.
And then the caretakers is more of a more comprehensive, intensive thing kind of endeavor. But I don't know what the question was.
Well, I see the care. I was about to say, let's talk about you were a caregiver for both
For
your
my
parents.
yes.
Right, and so I think you wrote about it in your book that you cared for your mom. I'm not sure about your dad because your dad was a little bit older, and I think you came from a family where cannabis use was more acceptable as opposed to my family where it was totally verboten. So that's the kind of difference I wanted to stand because here, like I said, I have a family where my father would be very unhappy to see me doing this right now. He's probably proud of me now. But okay, but in terms of what your family was
my
different.
family, no, that's not exact. I must have misrepresented because before my mother was diagnosed with cancer, cannabis was not a free-flowing type of thing in our household. But at that time, my brother and I, we were definitely using. We were teenagers. But and my dad was a pharmacist, so we weren't encouraged to use cannabis until my mother's doctor recommended the use of cannabis for, she had lymphoma, non-Hodgkin's lymphoma. And the thing is, that was in 2013, 2014. I came home and my mother was being given 9, no exaggeration, 9 pills, prescription pills for everything.
Right.
And I just to put it in a nutshell, cannabis helped tremendously reduce that number. When someone who cared really, I moved back home, and before that, there was no one looking things up and caring. And so, hello. So that's the difference. in, what they were prescribing back in just 2013. How things have changed because
Yeah.
back then medical wasn't even legal.
Right.
So I was coming back and forth from Brooklyn, New York, and fortunately our community provider of the herb lived in my building.
Okay.
And he was very knowledgeable before I even knew what he was talking about, the terpenes, the nutrition, and all this kind of stuff, and how it interweaved with the cannabis he was selling. And he asked the people, what do you want some cannabis for? And he would suggest, oh, let me give you some this, that. Basically, it was, you didn't have a big choice, indica or sativa.
I'm surprised you had that much of a choice
But,
back then.
I know, it was, but anyway, I would bring some back when I drove from Brooklyn to Columbus to take care of my mom.
So it's like he was kind of set up, because marijuana wasn't legal in New York
Not at
until
all.
pretty recently.
Yeah.
The late was 1819, something like that.
Yes.
At least medical, and I think they got adult use shortly thereafter. So he was setting up in Brooklyn. Brooklyn, was it?
Mm-hmm.
That he like his own kind of dispensary.
Absolutely. His father was a psychiatrist, and later I found out he recommended it.
Sure. So I told you purchased from a dispensary early on.
Well, all I know
Different as
is
a caregiver, see?
when I came here in 2013, I was asking around, and the only thing people would tell me is it's loud.
It's loud.
It's loud. When I say what kind of, what strain or whatever, and they would look at me and say, it's loud.
I'm not sure, I don't understand.
So it meant it was strong. You could
Obviously, I've been
smell
running
it.
that crowd.
Which I didn't know what they were talking about. I the same way you're looking. I was like,
Yeah.
what is that?
Okay.
So that's
I
no humor.
learned something today.
I didn't even know. All they would say is, and this is 2013, so 2016 medical.
Yes, of course.
I would have loved to have had the knowledge that I have now and the accessibility.
We needed you back then. We really needed you. I wish you would have joined us back then because we really needed a lot of advocates, and you were being very articulate and really a beautiful person to do that. So
Thank you. I'm just really happy to be in this group on this book. And thank you, Dr. Bridget. Whatever.
all right. Thank you, Dorothy. Thank you so much.
Thank you.
Taught me something. You guys taught me something. Thank you. I don't know everything.